Hello and welcome on to Dr. Shah's Health Insights. My dear friends and colleagues, today we're going to do the 10 signs and symptoms of hypertension. My dear friends, hypertension is a deadly and devastating disease, and if left unchecked, it can lead to life and fatal consequences and great amounts of mortality and morbidity, ranging all the way from myocardial infarction, from brain stroke, brain hemorrhage, kidney failure, and other end stage organ diseases. Therefore, it's very important to know the lifestyle disease. It's very important to know the important signs and symptoms of this disease so that we stay at bay and protect ourselves and our friends in community from this deadly and devastating disease. So let's go from 1 to 10. We will know together what are the important signs and symptoms so that we stay away from and protected from this devastating disease. So number one sign and symptom is nothing at all. Yes, you heard me right. Hypertension sometimes can be masked, and it's very well earned its notorious name as a silent killer. Therefore, it's of paramount importance for both for physicians and for patients to keep their regular health checkups and to definitely monitor their hypertension every now and then. Number two important sign and symptom will be frequent and sudden headaches, often early in the morning, associated with nausea, vomiting, and dizziness. Then number three will be immediate shortness of breath. You walk a little distance and you feel suddenly as if you are catching your breath. Then the other sign and symptom will be epistaxis or nasal bleed. Yes, you heard me right. Sometimes we often encounter sudden onset of nasal bleed or epistaxis as it is medically called. So therefore you should not ignore it or shrug it off. You should definitely look in and check your vitals and especially your blood pressure. Then again, there can be a sign and symptom of blurred and distorted vision. Especially out of nowhere you can encounter and experience sudden haziness, dizziness, diplopia or double vision or blurring in the vision. So therefore it should be checked. And the first thing that you're going to check is to check your blood pressure. Then the other classic sign is, of course, it's going to be chest pain right on the left side of your chest. And sometimes it radiates all the way to your left arm. It can even radiate all the way to your left hand, especially these two fingers. But often this classical sign is accompanied and associated with nausea, sudden sweating, restlessness, and a kind of a stabbing chest pain. So these are very, very classical signs of a heart disease or an impending heart attack or a myocardial infarction caused by sudden spurge or spike in the blood pressure. Therefore, this warning sign is very important and we should not at all ignore it and shrug it off. So quickly check your blood pressure. If it happens to be high, you should go to your emergency. Okay. Then the next sign and symptom is frequent dizziness, lightheadedness, giddiness, and feeling of extreme tiredness and weakness all throughout the day. Even after waking up early in the morning, you should be fresh, right? But patients with hypertension will be feeling too tired, too dizzy, and too much exhausted most of the times. So this is a sign which we should be definitely taken into account for. This is a sign which cannot be neglected as well. Going down the lane, we have one more important sign for you guys. Well, definitely sudden onset of irregular heartbeats, or as we say, palpitations. As we say, sometimes you often feel or experience a sudden skipping of a heartbeat, as we say. So these signs again cannot be shrugged off or ignored or just showed under the radar that it's going to be okay. I'm just having a little palpitations here and there. No. If you have palpitations and if it is bothering you, you should definitely get your vitals checked, and especially blood pressure should be the first thing on your radar. Again, sometimes palpitations can be an important sign of even heart disease, heart attacks, and even strokes. So sudden palpitations and skipping of a heartbeat should be not ignored. And the other important sign is very well encountered in the clinical practice is a very tingling kind of sound in the ears, kind of a buzzing sound in the ears, or a very wheezing sound in the ears, most commonly called as tinnitus. This often can be a masked sign and symptom of hypertension. So therefore, it can also not be taken for granted and therefore needs a very direct vital sign checkup. And lastly, but not the least, sometimes patients also come with swelling and edema, as we call, in the lower limbs. So sometimes if your ankle is swollen early in the morning, if you wear your shoes or slippers or anything, and you just feel that, sudden feeling of tightness or sudden feeling of heaviness around your knees or your lower limbs or ankles especially, this is called as pedal edema. So definitely, if you think that you have these signs and symptoms, the first thing you're going to do is check your blood pressure. And if it happens to be high, which in most circumstances it will be high, you should definitely get in contact and touch with your nearest physician to know more and to get the office blood pressure also checked and to get your underlying blood investigations done, all the way from lipid profile, serum urea, serum creatinine, and other basic vital organ checked, so that we know if you are diagnosed with hypertension, and if at all you're diagnosed with hypertension, it's very imperative to start the treatment as early as possible, because delaying the onset and the early treatment can lead to end organ damages. It can expose you to life-threatening conditions, all the way from myocardial infarctions to heart attack, stroke, epistaxis, and stage renal diseases. So hypertension treating is very easy. It can be easily controlled with the blood pressure medicines plus the lifestyle changes plus exercise, physical activity. So it's very important, first of all, to get your BP checked from time to time. And if you have a genetic disease and if you have a family history of hypertension, that's very imperative that you should be checking it from very early on. And again, if you're smoking, if you are on any recreational drugs, if you are drinking a lot, then definitely all these things, plus if you're under a lot of stress, as most of the individuals and youngsters nowadays are facing, all these triggers hypertension. And sometimes it can be masked, and sometimes it can mimic different symptoms. Therefore, it's paramount to know all the symptoms that we discussed before and to keep in mind, so that we are aware of this disease and so that we can save lives and so that we can be protected and we can be controlled and so that we live a happy life ahead. So that was the nutshell of today's important signs and symptoms. I hope it was useful and I hope you can take away the home message to be careful and to regularly follow up with your physicians and to get your blood pressure checked as regular as possible. So stay healthy, stay buckled up, and stay in the best of your life. All the best. Take care. Thank you.